Hello, I'm Dr. Leigh Willis, and I'm going to be talking to you today about games, health promotion, and behavior change. Let's begin. So, how can games be used for health promotion? Well, first, look at the definitions of health education and health promotion. Health education is the combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitudes. And health promotion is the science and art of helping people change their lifestyle to move toward a state of optimal health. So, people can be defined as the general public, it can be patients, it can be those living with disease. As a result, from these definitions, you can see that the game that you're creating is health education and a health promotion product. So, the goal of this effort is to create a game that will lead to some type of change in one or more of the following: either cognition, knowledge, intentions, behavior, and the development of skills. We want to make sure that games influence the adoption of behaviors and skills that are consistent with disease prevention. Games are a great method of educating because they can do so without threatening the audience's ego. And threats to the ego prevent behavior change because people don't like to be told what they're doing is wrong. So, a lot of times, people will hear messages that what you're doing is bad and you're bad for doing it. And games allow people to be educated without threats to the ego like that. So, some examples of health related and health focused games include CDC's own Solve the Outbreak game, which focuses on the epidemiology of disease. We also have the I'm Positive game, which we had a hand in helping create, as well as games on rehabilitation, more HIV/AIDS prevention, the famous Plague Incorporated. We also have cancer prevention games that specifically remission that was very successful. So you can see that there is a need and a place for games to help educate people and to change behaviors. So the use of games for behavior change is because behavior is often the result of a causal process, meaning that it is the result of knowledge, which is raising awareness and increasing the public's understanding about something, beliefs, instilling health beliefs that are consistent with prevention, attitudes, influencing health related dispositions to act in a certain manner, and finally, behavioral intentions, influencing people to engage in health behaviors. Knowledge. Knowledge, specifically health knowledge, are facts or knowledge about health that are acquired through experience, education, or by association, and providing health information to educate the public to offset the lack of knowledge and myths, which really will instill and reinforce the correct public health knowledge. So, for example, if you engage in X behavior, it causes cancer. Games can provide necessary information in a non threatening, casual, and engaging manner. Attitudes. Health attitudes may be indifferent, they can be positive, or they can be negative views towards a health issue. And they are the result of judgments that people either make consciously or unconsciously. So, for example, people may have attitudes about violence, mental health, exercise, nutrition, cancer, and even COVID-19. We want to influence and change attitudes so that they are consistent with disease prevention. We want to change attitudes like the following: I do not need to wash my hands because I'm a naturally clean person. It doesn't matter if you're naturally clean, everyone needs to wash their hands, especially in the age of COVID. I don't need to wear a mask. COVID-19 is a hoax, is another attitude that we would want to change with the game potentially. So games can be used in as a persuasive means of changing attitudes by demonstrating how certain attitudes can have harmful effects vicariously. So as far as beliefs, they are the acceptance or faith or confidence that the attitudes and knowledge that we hold is correct. So health beliefs are really important. This is one of the areas that poses a significant problem for disease prevention, as there are many false health beliefs or health myths. Examples of some of the myths that we may have to dispel is that social distancing doesn't work, masks don't work. You can always look and tell if someone has HIV or an STD. I can text and drive just fine. I can burn enough calories by doing my daily activities. Games can be used to expose these false beliefs and myths in a less threatening manner. Finally, behavioral intentions, and that is the intention to engage in the desired behavior. When individuals have knowledge, attitudes, and beliefs consistent with health promotion and disease prevention, it normally will translate into the intentions to engage in these behaviors. I know X is a threat to me. I can prevent it through engaging in the said behavior. Therefore, I intend to engage in protective behaviors to prevent disease. Simple as that. However, they may be barriers to engaging in these behaviors. Games can demonstrate how to overcome these barriers that people may face while attempting to engage in the appropriate health behaviors, as well as what happens if they decide not to change their behaviors. So we can see that there is a causal chain that I was talking about a little bit earlier, starting with knowledge, which influences beliefs, which influences attitudes, which influences behavioral intentions. And behavioral intentions directly impact behaviors. And that's not to say that these things can't directly impact health behaviors or the engaging in health behaviors, that is. But it usually works in this causal manner. So skill building, finally, is there's a need to build skills so the audience can engage in the desired behaviors. That's what we want you to try to help us do. It can be the public health workforce to enhance their ability to do their job by, explaining how they can interact with people, how they can deal with emergency situations, how to properly wash their hands, to the general public to enhance their ability to engage in health behaviors such as, condom negotiation, how to interact with clinicians, how to follow their rehabilitation activities. And skills are often built through demonstrations and simulations like games. One thing that we need to be aware of is there's a delicate balance. While we want to make sure that there is educational content in the games that you create, we also recognize that your game will need to be fun and engaging for the player. Otherwise, they're not going to enjoy playing it, and therefore they will not really learn anything from the game. And the repetitions that are so important for building skills and knowledge and intentions will not happen. So try to make sure that there's a balance between entertainment and education. So the goal is to create a game which changes the behavior consistent with our disease prevention efforts. Your work will be a valuable addition to the public health arsenal. So the focus of your game, we obviously know the problem of interest is COVID-19. You need to think about who's going to be the general audience of your game, the general public, health professionals in general, essential workers. Some other questions for you to consider from the health promotion or health education perspective is, what does your audience need to know to prevent this problem? What are some of your educational objectives for your game? And what skills do your audience need to learn? As far as the health promotion questions to consider is, think about, how does your game promote health? How does it prevent disease? What can your audience actually learn from your game? And then how will the audience learn from your game in terms of the activities that you will build into your game? So possible focuses of your game may be educating, just generally raising awareness about the issue. Again, building skills and awareness. And finally, demonstration, showing how to perform a said action or skill. And that's it. I wish you the best. I wish you luck. You will have my contact information as well as my other colleagues at CDC, and you can reach out if you have a need for more information. And I will also probably be available on the Discord. And one last thing is I need to read this disclaimer. The findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the Centers for Disease Control Prevention. Good luck and be awesome. Thank you.